New York City Mayor Eric Adams has publicly criticized former Governor Andrew Cuomo's handling of the COVID-19 pandemic. This critique, delivered on March 25, 2025, reignited a contentious debate about Cuomo's leadership during the crisis. Adams specifically targeted Cuomo's handling of the nursing home scandal. He also highlighted racial disparities in the distribution of vaccines and personal protective equipment, or PPE. Adams's comments were particularly pointed. He questioned Cuomo's managerial competence. This came after 9 mayoral candidates, excluding Adams and Cuomo, commemorated a somber anniversary. They gathered to mark the date of Cuomo's order mandating nursing homes to readmit COVID-positive patients. This order, issued early in the pandemic, has been heavily scrutinized. Critics argue it exacerbated the spread of the virus among a vulnerable population. The controversy surrounding the order forms a central part of the larger debate about Cuomo's pandemic response. Cuomo, through his spokesperson Jason Ilan, has forcefully denied any wrongdoing. Ilan defended the nursing home policy. He stated it aligned with federal guidelines at the time. Ilan also pointed to national PPE shortages. He argued these shortages hampered the state's ability to adequately protect nursing home residents. The nursing home scandal lies at the heart of the criticisms leveled against Cuomo's COVID-19 response. At issue is the state's decision to require nursing homes to accept COVID-positive patients discharged from hospitals. This policy, implemented in the early days of the pandemic, has been blamed for accelerating the spread of the virus within these facilities. Critics, including Mayor Adams, argue that this policy demonstrated a disregard for the safety of vulnerable elderly residents. They contend that the Cuomo administration prioritized freeing up hospital beds over protecting nursing home residents. This decision, they argue, had deadly consequences. Cuomo and his defenders maintain that the policy was necessary to prevent hospitals from being overwhelmed. They argue that the state was following federal guidelines in place at the time. Furthermore, they point to the national shortage of PPE as a significant factor hindering their ability to protect nursing home residents. The debate over the nursing home policy is further complicated by accusations that the Cuomo administration intentionally undercounted COVID-19 deaths in these facilities. This allegation, if true, suggests an attempt to downplay the true human cost of the policy. Mayor Adams also highlighted the racial disparities that characterized New York's pandemic response under Cuomo. These disparities were evident in various aspects of the state's handling of the crisis, including testing, access to healthcare, and the distribution of vaccines and PPE. Data revealed that Black and Hispanic communities in New York City were disproportionately impacted by the virus. These communities experienced higher infection and mortality rates compared to white residents. Critics argue that these disparities reflect systemic inequalities in access to healthcare and other essential resources. Adams and others contend that the Cuomo administration did not do enough to address these disparities. They argue that the state's response should have been tailored to the specific needs of communities disproportionately affected by the virus. Cuomo's defenders maintain that the state worked diligently to ensure equitable access to testing, treatment, and vaccines. They point to initiatives aimed at increasing access to healthcare in underserved communities. However, the data on racial disparities in health outcomes suggests that these efforts were insufficient to bridge the gap. The recent criticism by Mayor Adams has brought Cuomo's handling of the COVID-19 pandemic back into the spotlight. The debate over the nursing home scandal, the racial disparities in the state's response, and the allegations of undercounting deaths continue to cast a shadow over Cuomo's legacy. New York Attorney General Letitia James conducted a comprehensive investigation into the Cuomo administration's handling of nursing homes during the pandemic. Her 2021 report found that the administration had undercounted COVID-19 deaths in these facilities. The report also concluded that the state's policy of requiring nursing homes to accept COVID-positive patients may have contributed to the spread of the virus. The findings of this report, along with the ongoing public debate, raise serious questions about the decisions made during a critical period in New York's history. The full implications of these decisions and the long-term consequences for the state are still being assessed. One thing is clear, the COVID-19 pandemic exposed deep-seated inequalities and systemic failures that must be addressed to create a more equitable and just society.